The slump sit test for the lumbar spine can be used as a screen to rule out lumbar radiculopathy, as this is a very sensitive measure. Let's say previous to this our patient had subjective complaints of pain down the right lower extremity. We want to position our patient in a short sit position, making sure they have a neutral pelvic alignment. So we can actually reset their pelvic alignment, making sure it's neutral, by giving them just a little tug here, making sure their knees are close together. Then we will want to do is assess resting symptoms. Let's say the patient still has some symptoms down the right leg. What we want to do is then ask them to slump into some lumbar flexion while maintaining their hands behind their back. Good. I then want to assess for resting symptoms once again. In the same position, I'm going to gently load and assess again for resting symptoms. Let's say there was no change in resting symptoms with this procedure. What I want to do now is ask them to extend the knee. Good. Keeping the knee extended with your leg, then ask them to dorsiflex and maintain that pressure. Again, assess for resting symptoms. This is obviously a positive for my patient, but for the sake of this video, let's continue. Say our patient did not have symptoms in that procedure. What I want to do is then ask them to flex their head all the way down and provide some overpressure. While providing that overpressure, maintaining the dorsiflexion that I'm not going to do for the sake of my patient, we can assess resting symptoms once again. If there are no symptoms with this position, that's a negative test. If there are symptoms, we then ask our patient to extend their head and see if there's a change in symptoms. 3 things are necessary for a positive in this test. We need sensitization, we need reproduction of concordancy, and we need asymmetry between the opposite side.